Good afternoon, all. So today we are going to study one of the topic of community health nursing. This is an important topic of community health nursing, that is home visiting. Okay. So as we know, what is the meaning of home and what is the meaning of visiting? So here, so today we are going to study when we are this home visiting, how to do, what is the purpose, what is the principles, what are all the advantages, all those things. Okay, so when we are talking about the community health nursing, or when we are working as a community health nurse and we are going to provide community health services to the people. Okay, so to achieve the community health services goal, it is nothing but a community to improve the community health as well as to maintain the health of the community or to achieve a healthy community. The community should be healthy. There should be sound community. So to achieve that goal, we need to, as a healthcare professionals, we need to do the home visiting as a community health nurse. Okay, so here what we are going to do? What is the necessity to do the home visiting? Because people can come to the primary health center or community health center, they can take treatment, they can whatever they are having the problem, they can seek the need this one care treatment. Doctors will be there, nurses will be there. They directly they can come and they can take, right, as a hospital. But in case of community, when you are studying community health nursing, you forget about the hospital side, because in the hospital, people, the patients will be coming and they will be taking treatment. But in case of community health nursing, it is little different. Why? Because mainly in the rural community, so many people are there old age, and so many people are there uneducated. They will be not having the knowledge as well as they will be not having any kind of awareness towards the health. If they are having disease condition also, they will be being at the home only. They will be not thinking about their health as well as what and all the services are available in the community health center or primary health center or sub center. They will be not coming and they will be not knowing. So to achieve that goal, like that community health services goal, community health goal, we have to do the home visiting. Because once we are going and directly visiting their home, people's home, door to door step we are going, doorstep we are going, and we will be founding all the peoples at the home, because peoples are founding at home, so we can observe all the peoples. Not only the single person will we are going to observe, or we are going to assess. We are going to assess in the home, that in particular home, father, mother, grandmother, grandfather, daughter-in-law, son-in-law, children's, everyone will be finding, and we will be assessing as a family, full family, how is the health, what is their condition, and what is their environmental condition, whether they are maintaining the hygiene or not, whether they are maintaining the environmental sanitation or not, which and all which and all nutrition, how the nutritions they are eating, whether they are malnourished, whether they're not eating properly, whether they are unhygienic, all everything we are going to see, even assessment of their health as well, health related everything, potential risk, all those things. So how to do this? Now we are going to study introduction of the home visit. So you see, introduction tells a home visit is one of the essential part of the community health services, because most of the peoples are found in a home, especially in rural community. Think about the rural community. Mainly the peoples will be at the home if they are having the health problems, or they are not having the health problems also, old age peoples will be there other peoples are also will be there. So once we are as a health professionals, we are directly going to their doorstep, directly we are visiting the home, we can find all the things, we can assess them, we can give services, we can give necessary nursing care, we can give the nursing care, as well as we can give the health related activities to improve their health, to maintain their health, okay, or also to prevent the disease conditions, to promote their health, okay. That is the reason they have said it is the important, this home visiting is an important part of the community health services, because we are directly visiting, directly going to the people's home, and we can see all those things, we can observe, we can assess, we can do everything, and it will be helping for what? It will be helping for achieving the community health services goal. The next, it is helping, it is telling, it fulfills the needs of individual, family, and community in general nursing services as well as the health counseling, because once we are going to the home, directly we are visiting home peoples, we can meet, because we are going and directly we are talking, we are building one good relationship, means each and every one of the family will be sharing their problems, then you can identify what and all the problems will be there, each and every individual will be there, individual makes the family and family makes the community, so automatically family, your home, you are visiting each and everyone's needs, you can identify, you can meet their needs, you can give the necessary nursing care to all individuals, not only the children, not only the adult, not only the grandfather, grandmother or anyone, you will be giving care as a family member, as a unit, as well as you will be giving the advices, counseling you will be giving to how to improve the health, okay. As a healthcare professionals, you are going and you are going to give the health education as well as the health related activities as well as health advice, how to improve, how to promote, how to prevent the health, prevent the disease conditions, all those things, okay. Next, it is a backbone of community health services. Obviously this is helping, because by doing home visiting, you can identify each and everything. You can identify potential risk, you can identify the actual risk, actual disease conditions, all those things of the peoples, all the problems, not only the disease condition, all the problems which are influencing in person health or affecting the person's health. So it will be helping it will be giving all the information, this home visiting will be helping to collect all the information, and this information will be helping for what? To give necessary nursing care, to provide all the community health services to the people to achieve the health. The next is, a home visit is a family nurse contact which allows the health worker to assess the home as well as the family situation, okay. This home visiting is helping a nurse to assess the home as well as the family situation in order to provide the necessary nursing care as well as the health related activities, okay. How the family situation is, whether the relationship of the family in the family it is good or not, how it is, okay, and as well as how the knowledge level of the family members, as well as the what is the reaction of the people, how they are reacting to this situation, as well as, like, some people, if as a nurse if you will go and people you are visiting the home, you are going to visit the home, some people will be not having any interest, okay, some people will be having the interest. So these all situations, you have to make a good relationships, and then you understand the situation, you assess the home, you see the family situation, and this will be helping you to provide the necessary nursing care whatever they require according to their situation, as well as the health related activities which will be helping to improve as well as the maintain their health. The next is we are moving towards the definitions. So what is the definition of home visit? Home visit is defined as the process of providing the nursing care to patients at their doorstep. It is nothing but it is a process. Okay, we are following some of the steps. We are going to study later these ones, steps of home visiting. So it is a process, step by step we have to do. So it is a process of providing nursing care to the patient. Okay, nursing care to the patient who were at their doorstep. It means at their home. Directly you are going and you are giving directly care to the patients, and it requires technical skills. You should, as a nurse or as a healthcare professional, you should have the technical skills, resourcefulness, as well as a good judgment, and you should build a good relationship with the family members or with the patient when you are doing the home visit. Okay, so it is nothing but what? It is a process of providing the nursing care to the patient at their doorstep. Is nothing but at home. You see the picture, you can identify how she came along with one family folder, one black color folder file, and one bag. Okay, one bag, that is community health bag. The next is another one definition, that home visit is a purposeful and deliberate psychosocial activity undertaken by the health team members for meeting the diagnostic and therapeutic needs of the family. Okay, now here home visit, you are going to give what? Family health care, direct. Not only the individual care, individual patient, you are not going to give any, you are not going to assess the only the patient. You are going to assess all the individuals in the family, all the members of the family. You have to observe all the home environment, you have to observe all those things. Their social condition, psychological conditions, physical conditions, everything you are going to assess. Okay, not only one member, full family. So here you are going to give full by this. It is a, who is taking this one responsibility? It is a purposeful, right? It is a purposeful as well as a deliberate psychosocial activity. Okay, it is a purposeful as well as the intentional or conscious psychosocial activity who has undertaken the healthcare team members. Healthcare team members for what? For meeting the diagnostic in the sense to detect the disease or identify the disease conditions, as well as the therapeutic needs of the family. Therapeutic needs of the family. Okay, therapeutic is nothing but what? Treatment. Treatment needs of the family. So here the second definition is telling it is a purposeful as well as the deliberate psychosocial activity undertaken by the home healthcare team members for what purpose? To meet the diagnostic as well as the therapeutic needs of the family. Then moving towards the objectives. Objectives of the home visit. Okay, like goal or aim of the home visit. What is the aim? Why you are doing? So you see, that is to obtain information for family assessment. Okay, to obtain, to collect information for assessment of the family. To assess the family, we need to collect this information from the family member for assessment of the family only. The next is to get acquainted with the family. Acquainted is nothing but to get familiar with the family. Familiar, okay? We need to build a relationship for achieving the community health services, achieving the goal of community health services. Okay, so for that we need to build a good relationship. Then only we can make a perfect or effective home visiting, and we can give care, quality care to the family members. The next is to begin a relationship of continuing assistance in the family health and health related needs. Okay, to begin. Why we are doing the home visiting? For what? To start a relationship for the continuing assistance, because community health services or these community health nursing, it is a what, or family health nursing, it is a long term system. So for this long term continuing assistance, for the continuing assistance by the family, we need to build a good relationship, or we need to build a or start a relationship. So for that we need to do the home visiting. Okay, the next is purposes. What is the purpose? Simply we are not going unnecessarily, we are not going and visiting the people's home. We are not going door to door step of the people for the chit chatting or doing anything, something. We have some purpose here. We have some purpose. So here we are going to study now what are all the purposes of doing home visit. So first one is to find out the needs of individual, family and community in relation to health, socio-economic and cultural aspect. Okay, it is nothing but what is the purpose? To identify what is the need of the individual. Okay, related to what? Related to health, related to socio-economic status, as well as related to cultural aspect. Okay, which is coming, which is influencing whatever the factors the people's need related to health, mainly related to the health. To find out that one, we have the purpose of doing the home visit. The next is to provide domiciliary midwifery as a care for pregnant, delivery and puerperal mother and infant. Okay, so here to provide domiciliary midwifery is nothing but what? When we are doing home visiting, we can find out who and all, which and all women are the pregnant. Okay, which and all women are the pregnant, or which and all women are going to deliver, like near delivery date is coming, and which and all women they have given birth, like delivery has over, the birth of baby has done after the delivery. So all those things we can find out once we are doing the home visiting. So this will be helping for to provide domiciliary midwifery to give direct care to the antenatal mother. Antenatal mother in the sense pregnant woman. Then during the delivery and during puerperal mother. Puerperal mother and infant is something but puerperal is something but postnatal is after the delivery till 6th week or 42 days, we are calling it as a puerperal period. Okay, and infant or newborn, that is the baby. Okay, so what is the meaning of here midwifery? You may have the doubt of this. Midwifery is nothing but midwifery or midwife. Who is midwife? Midwife is a, she's a nurse who is assisting for childbirth. Okay, who is assisting for childbirth. The next is to give care to the sick. Okay, to give care to the sick is nothing but like those who are sick, especially they have given to a postpartum mother. Postpartum mother means those who have delivered a baby, and her newborn. Newborn means just 0 to 28 days of the baby. The new delivery has been done, that baby, with a view teach a responsible family member to give subsequent care. Okay, she as a nurse, she will be giving care to the postpartum mother as well as her newborn. As well, she need to teach who can give care to the that postpartum mother, or who has given birth now delivery. That mother, if the nurses are not available, or if some of the care nurse will give, but some others care, everything the nurse will be not doing. Sometimes some other cares family members can do. Okay, they need to help, they need to support the mother. The next is to assess the living conditions of the patient, okay, as well as his family and their health practice in order to provide the appropriate health teaching. Okay, appropriate health teaching is nothing but once we are doing the home visiting, this home visiting will be helping to assess the lifestyle, living conditions, how the patients are at home as well as their family members, and how they are practicing their health, to maintain the health, how they are practicing, whether they are eating good nutrition or not, whether they are doing the regular exercise or not, whether they are maintaining their personal hygiene or not, whether they are wearing clean clothes or not, whether they are maintaining the home environmental, that sanitation proper or not, all those things that is related to health, right? If it is unhygienic, if it is they are not eating nutritious food, their immune system will be down, as well as if the environment is unhygienic, all the microorganisms will be causing disease. Okay, health practices in order to provide appropriate health teaching. Okay, that is you have to assess the living condition you have of the patient, as well as means here by the home visiting we can assess this living condition of the patient as well as the family members living condition and their practices. By this you can identify everything. If they are lacking something, you can plan a health education, then you can give a health education to them. Okay, the next is to provide basic health services for minor ailments. Minor ailments mean small injury. Okay, small injury, balls, abrasions. Okay, like some children are playing, suddenly fall down. So what will happen? Hand, legs, the knee, elbow, and all full skin will come out and little bleeding. So you can give some basic health services. Then next is to provide counseling on family planning, immunization and nutrition. Okay, counseling is nothing but you will be giving advice, knowledge, information. Okay, on what? On family planning as well as immunization and nutrition. The next is to give health teaching regarding the prevention and control of disease. It means you are giving knowledge, you are giving awareness. Once you are doing the home visit, by doing home visit, when you are doing, you can give the health education to provide the health teaching regarding prevention of disease condition as well as the control of disease condition, like how to prevent, like regular exercise they can do, they can maintain their hygiene, good nutrition they can eat, as well as they should avoid the alcoholism, tobacco use, all unhealthy habits they can, related to unhealthy habits they can give the educations. So thereby you are bringing the awareness towards the people, towards that health, their health, that education you have to give. So by this home visiting it is helping for giving health teaching regarding the prevention as well as the control of diseases. The next is other to establish a close relationship. Okay, once we are going to the home of the, we are doing the home visiting, usually directly we are contacting with the people, okay, family members. So it will be helping for what? To build a close relationship. Okay, it will be helping for what? Public health, public, it will be helping for improve the public health. Okay, between the nurses, this relationship between the nurses and the public for promotion of health. The next is to make use of an inter-referral system and promote the utilization of the community services. Okay, this home visiting will be helping for what? Once you are going home of the people, you can tell this PSC. If you will go to the PSC, doctor will be there. Then you can consult the doctor and you can get the what? You can get the treatment. So that is inter-referral, as well as from primary health center to community health center. The home visiting will be helping. You can tell directly to the people which and all services are available in the sub-center, which and all services are present in the primary health center, which and all services are present in the community health center. So you are making use of this inter-referral system and you are giving this one information, then people can go. And to promote the utilization of the community services, the government of India has given so many things, so many community utilization resources. So resources they have given, but so many peoples, rural peoples, not knowing what the services are available in the primary health center, sub center, and community health center. So you are going and you are telling, you are giving information to them, then they can come forward, they can participate, and they can utilize these community services. Then next, moving towards the principles of home visit. Okay, so here the home visit should have a purpose and objectives. It means unnecessary we should not go to the people's home and we should not do. So there should be a purpose and there should be objectives. Okay, objective is nothing but what? Goal or aim. Okay, the next is the home visit should be planned according to the priority. Okay, priority is what is the need, the highest level of need. Okay, then next priority, like one diabetes patient is there and one cardiac patient is there. Okay, in same family as well as the other family, or also one postnatal mother or delivery mother is there. So you have to give care, which and you have to prioritize the care. Okay, which family is required, which care first. So you have to plan according to the priority. Okay, and maybe some community, some home is having problem, like immediate problem, accident, so you have to go immediately. Okay, or else some family is having tuberculosis or else corona, one person affected, so immediately you have to go to visit. It should not spread to others. So this is the priority. Corona positive one patient if you will be getting in the community, so you have to isolate immediately, you have to go for the visit that family. So that is immediate, that is priority. So you have to identify which is the first requirement you have to meet. So according to that you have to plan, and according to that you have to visit the family. The next is the purpose of the home visit should be clear, regular, and flexible. Okay, what is the purpose? It should be clear, it should be regular, as well as it should be flexible. It should not be rigid. Okay, the next principle. First of all, once you are going to do the home visit, you have to introduce yourself. Okay, you have to introduce yourself, your institution, means from where you are coming, then what is your purpose of home visit, and collect all the facts about the individual and family environment. The next is establish a good interpersonal relationship. Okay, you should build a good interpersonal relationship between you and family members. Okay, and you need to be polite, courage, and friendly with the family members. The next is carefully listen the family and understand the other's person view. Okay, you need to listen the family carefully. Okay, whatever they are speaking, whatever information they are giving, and understand the person who is giving their view point, their opinion. Then next point, health education and nursing care should be scientific. Okay, based on this, you should, whatever performance, whatever care, whatever procedure you are doing, that should be scientific. They should have the proof, evidence based practice you should follow. Then use safe technical skills and scientific nursing procedure. Okay, use safe technical skills and scientific procedures, scientific nursing procedures. The next involves whole family. Okay, when you are going to do the home visiting, when you are visiting their home, you need to involve whole family. Okay, when you are giving such any information, any health education, any things you are assessing or whatever you are doing, you need to involve the whole family members, okay, during the nursing care. Then the nurse and family members must develop a positive interpersonal relationship. Okay, positive interpersonal relationship you need to, what you need to build. Okay, for what? To achieve the present goal. Present goal means what? What is your goal? Maybe you are going this time home visit, you are doing, you are for what purpose? Maybe your purpose is to assess the how many member, like you want all the family in the community, all the families you are going, and you are going to assess how many members are there, how many children are there, what is the age of the children, and what is the weight, what is the height of the children's, and what is the weight of all the, like general assessment, only for the general assessment you are going this time. Okay, so to achieve that goal, you need to develop a positive interpersonal relationship, as well as you need to build a good relationship. Yeah, yeah. As well as you have to involve all the members when you are doing the home visiting. The next is evaluate your own work periodically. Okay, whether you are going correctly or not. Okay, what is the track, what is the step by step you are following, we are doing the home visiting, whether it is going correctly or not, you need to evaluate your work also. The next is make a note of important facts about the home visit in your diary. Like one person is malnourished, one children is malnourished, or one one child behavior is not as normal. That is important fact or important point. Okay, so that and all point you have to, such kind of point you have to note in your diary. Then thanks to the family members and individuals for good response. Okay, thanks to the family members and individuals for their good response during your procedure, during your visit. So these and all are the principles of home visit. Now moving towards the steps of home visiting. So here there are 6 steps of home visiting, how to do the home visiting. Okay, you want to do the home visiting for some purpose, to achieve the goal of community health service, or to you want to assess the family members, you want to give nursing care to the family members. So how you have to do step by step, that we are going to study now. So here you see fact findings. Okay, fact findings. First, in fact findings, you have to see which community, where is the location of the family. Okay, which family you are going to visit, you have to see the location of the family. You have to go, how many members are there, family members, sex, age of the patients, all those things you are going to collect. Here you are going to build a, like, good interpersonal relationship. In fact, you have to find the fact, what is the location, what is the disease condition of the patient, what is the age, what is the sex, what is the economic conditions, what is the personal conditions, all those things. Here in the fact findings you are going to find a fact. Then you are going to, second step, Fact finding is the first step of the home visiting. Second step, data finding. Data finding means information, history. You have to take the history. You have to take the information. Okay? That should be genuine information. That should not be false information or anything. That should be genuine information. Okay? That can be, as we know, health is complete state of physical, mental, social, spiritual well-being. So all the data you can take: social information, physical information, then physical data also you can take, social, emotional data also you can take, everything you can take. That is about the data finding. Then planning action with individual or family. Planning, then after taking the history data, then you are going to plan what are the problems. Data finding means you are going to find out the problems, then you are going to plan action, planning action with individual or family. Whatever the problem will be there, that you are going to study. Like one patient is diabetes, think about one patient is diabetes. Okay, there one patient is, think about one patient is diabetes and this. So you are going to plan how to control, how to maintain the health of that patient in their family. Okay, with that individual as well as with the family members. This is the planning action. The next is action and health educations. Action, what is the action? Here, like diabetes patient, what they have to do? Diabetes patients have to do how to control the blood sugar level. Then should not eat the more carbohydrate like rice, then potato, sweet potato, sugars. They should not take all those things, and they can take like green leafy vegetables, bitter gourd, then some juice. Okay, this and all, which and all are like more fiber rich diet they can take, low carbohydrate rich, which will be not causing or not increasing the sugar level in the blood, not harming. So to maintain that one, which and all action, that is only they should do the regular exercises. Okay, this and all action you have to do with the along with the family members. They have to individual, the patient have no, should not eat all those things, and they should or eat these things, and they should follow some of the instructions which will be helping for their maintaining their health. And you have to give the health education. Okay, action. In this action, once we are doing the home visiting, you have to do the, like you have to assess, you have to check some things like how much the blood sugar, glucometer you can take, and you can check the blood glucose level, fasting blood glucose level, postprandial blood glucose level, all those things. And also whether their kidney is affecting or not, whether like those who are chronic diabetic patients, their kidney also may affect, complications of the diabetes, they may damage the kidney. Okay, so in urine we can check whether glucose is present or not, protein is present or not. So for that we can do as a home, when we're doing the home visiting, we can do the test of urine analysis we can do, that is Benedict test or acetic acid test. This Benedict test is helping for checking the presence of glucose in the urine, and acetic acid test is helping for checking the protein level in the present, protein present in the urine. Okay, right, these all those actions you are going to do in action things. This is the fourth steps. Then follow up. Okay, in follow up steps, it is helping for what, whether the patient is following all those things or not, whatever you have planned. Like they should not eat the potato, sugar, rice, and all. They should eat like chapatis, green leafy vegetables, fiber-rich diet, fruits they can take. So this and all. Whether the patient is following or not, how much the goal has been achieved, whether the patient is following the instruction or not, how far the patient has followed the instruction, all those things, whether the blood glucose level is maintained or not, whether it is going high or low or maintained, you are going to do the follow up, means how far you have achieved the goal of this home visit. Periodically you will go and you will do the follow up, you will be going visiting and you will be checking the patient. Okay, the next is evaluation of the series. Evaluation of the series is nothing but what was the actual problem, what was the present problem, what was the total problem, how far the home visit was effective, then whether it was effective, or whether it has been, the goal has been achieved or not. This all those things, even you are going to assess your performance. Okay, here this in this evaluation of service. So these and all the steps of home visiting. Fact findings, you are finding out the facts, or the patients, all those things, location of the patient, home and all. Then data findings, you are collecting the informations, you are assessing all those things. Then you are planning actions with the patients as well as individual or family. Okay, planning all the actions, which and all will be helping for this, which and all actions you are going to do, we are going to follow for achieving the goal. Then in next steps, it is like a implementation of the planned things, implementation of the planned things. You in the fourth step, this is the action and health education is the fourth step of the home visiting. In this, you as a nurse, you or and family members and individuals will be working together to achieve the goal. Okay, follow the all instruction, follow everything, all those things, as well as you will be giving the health education. For example, I have given the diabetes one. Okay, health education related to diet, exercise, all those things, medication, taking the medications as proper time, everything. Then follow up. Follow up is nothing but periodically you will be going and visiting the family and the patient, how far the goal has been achieved, whether the blood sugar level is normal or not, whether it is maintained or not, or how far the patient followed the instruction on, followed the instruction, and how far the goal has been achieved. The next is evaluation of the service. In evaluation of the services, it is nothing but you are going to evaluate yourself as well as evaluate the home visiting, and what was the actual problem, what was the potential problem, everything you are going to assess, and how far it was effective, how far they have understood the family, your instruction, your educations, your health, these advices, counseling, everything to achieve the goal. Then moving to advantages. Okay, it is about what are the advantages, as we now we have studied the full home visit. Okay, what advantages means, directly we are contacting, directly we are visiting at their home. So it will be helping for what, it will be helping for building a good relationship between the family members and nurses. And it will be helping, next point, it will be helping the nurses to assess the individual and family member, assess the family member and individual directly at their own environment, not in the hospital. Directly you are going to their home and you are talking and you are assessing them directly where they are living. Then this home visiting is helping, as well as it is giving opportunity to observe the background of the family. Okay, it is helping for what, it is helping for observing the background of the family members as well as the relationship, whether the each and every members of the family is having the good relationship between each and every members or not. Okay, as well as the what is their background. So next one is it is helping for the basic understanding of the physical and emotional needs of the individual and guiding them. As a nurse, you will be guiding them by understanding their emotional needs and physical needs. Okay, then it will be next one. It is helping for what? To gain more knowledge and become more realistic as a family member, are more relaxed in their home surroundings. So it will be helping for to gain the more knowledge as well as becoming the more realistic to the situation. Then it will next one, it also gives an opportunity to find out new health problems. Okay, directly you are going home, right? New health problems, like one person is sick. Okay, one person is having the communicable disease. This may spread to, like corona, one person is having the corona or one person is having the TB. This means if they are not taking care, they are not isolating, it may spread to other members of the family also. That is, new problem can arise, so you can identify. Okay, as well as some peoples are there like maladaptive behavior, social behavior will be not good, like there some peoples, the adolescent peoples usually, like which home you are visiting, in that adolescent one boy is there, like 17 years or 18 years or 16 years. Nowadays this is fashion, smoking is fashion, alcoholism is fashion. So you can find if they are starting this kind of behavior, that that boy is following this lifestyle. He started to smoking at this age, he started to smoke and he started to drink. So what is the thing, at next new problem can arise. As well as maybe some people was not having the disease condition, but now it is starting. So as early as possible, once we are doing the home visiting, you can find new problems of the health. So here, so today we have studied, yeah, now home visiting. As we know what is the meaning of home, as a healthcare professional we are directly visiting, purposefully we are doing the visiting to the people's home, and we are giving directly nursing care to the patient at their doorstep. And we have studied what are the objectives or aim. What is the objectives or aims? To give nursing care to the family, or to give community health services to the family or individual or community directly at their doorstep, to improve their health and to improve maintain the health, as well as to get the to obtain information. And we studied so many purposes. Okay, to give postnatal mother care, to antenatal mother care, to give like to give care to the patient, sick people, all those things. And also to assess the family members at their own environment. And we saw the principles, there are so many principles. So first of all, when you are going to do the home visiting, when you are going home to visit the home, you have to introduce yourself. You have to introduce from where you are coming, which institutions, what is the purpose of home visiting. According to that, you are going to give care, advice, all those things. Okay, that should have the clear purpose, flexible purpose. Okay, they should have the objectives. So we saw so many principles. Then we saw the steps. There are 6 steps. First one is fact findings, then data findings, then planning actions with the family members or individual. Then whatever you plan, that you are going to implement, that is action and health education. After that, follow up. how much it has been achieved. You are going to see in the follow-up steps. It is an important step of home visit. Then evaluation of the services. Then we saw all the advantages. Okay. So this is about home visit. I hope you all understood. Okay. Thank you so much for today.